Mike Laidlaw, and I'm an operational consultant for SmartSource. Today we have a very interesting and timely webinar entitled Elevate Your Human Employees Output Next Generation AI Assistants. This seminar will be presented by Matt Leventhal, Regional Manager, and Tim Moore, Director of Healthcare for SmartSource. And with that, I'm going to turn it over to Tim. Tim?
Hello, everybody. We're glad you took some time out of your busy schedule to meet with us. We hope this will be informative and you'll find benefit for attending. Let me give you a 30-second on SmartSource. SmartSource, we are a consulting and sourcing company with deep roots in healthcare. We have hundreds of hospitals and medical groups as clients across the country. Artificial intelligence is one of those words that everybody says and few people really understand. So our goal today is to try and show you practical real-world applications of this technology and how it helps hospitals and medical groups. And with that, I'll turn it over to Matt to walk you through some use cases.
Sure. Thanks, Tim. Thanks, Mike. Let me just start with, yes, AI. Everyone's hearing this term at nauseum, and we're going to help dispel some of the myths that are out there and show you what is truly impacting some of the organizations. Let's just start with a video.
Thanks for calling First Health General Hospital. In a minute, your call will be answered by a thinking machine. This call may be recorded for quality and monitoring purposes.
Hi, this is the virtual assistant. How can I help you?
I would like to make an appointment.
No problem. I can help you with that. I have identified you from your caller ID and looked up your doctors. I need to ask you a few questions to confirm your ID. Is that okay?
Go ahead.
What is your date of birth?
March 12, 1995.
And your zip code?
10018.
Martin Smith. Welcome. Which of your doctors would you like to make an appointment with?
Dr. Andrew Blank, please. Sorry, my baby's crying.
No problem at all. I have Dr. Blank scheduled up. When would you like to come in?
Would it be possible in about 2 weeks in the morning?
Hold on for a minute while I look.
Here we go. We have an appointment available 2 weeks from today on Tuesday, May 19th at 8 a.m. at 955 Main Street. Does that work for you?
Do you have anything a bit later?
How about 10 a.m. or 10:30 a.m.?
10 a.m. works.
Martin, I am confirming your appointment with Dr. Blank on Tuesday, May 19th at 10 a.m. You will shortly receive a text message also confirming the appointment.
Thank you for calling First Health General Hospital. Good day.
All right, so as you can see, that is a very straightforward. Someone needs an appointment. We refer to digital employees and human employees. We don't mean to make it impersonal, but it just drives the differentiator as we talk about AI. We just got back from HFMA in Vegas, and as expected, every booth in the exhibit hall and every supplier and every person who would say revenue cycle now is using AI. And as we ask people, what does that mean to them? We get the same answers every time, and now some new answers. Generally, it's like ChatGPT. We also get people who are afraid of it. They believe, they've seen the movies, the iRobots and the Terminator, that, it's going to take over the world. Those are all generative AI, agentic AI, which are new terms that are out there, where you're asking questions and the system is finding information from the internet or from wherever and making a decision and giving you an opinion, basically. That is not what we do. We work in a closed system that is driven by you and its decision trees, its conversation trees. So we'll get into that more, but I wanted to make that point that when people talk about AI, if someone's explaining AI to you, if they don't say our AI does X, Y, and Z, you need to ask more questions because it may not be all that they're cracked up to be. So our conversations were, we do conversational AI in a closed loop to help you with scheduling, pharmacy, anything that your call staff, your call centers, or your frontline staff is answering over the phone and taking care of. That's where we play. We don't play on the other side. And I'll be very, very careful with that, obviously, with other folks. So what we're doing is, it's really intelligent scheduling. It's rules-based. Provider, practice, patient, location. That is all driven by you, not by us. You tell us what you need it to do. We will help develop the technology and the conversation trees. They can always get to a live body. I'll repeat a few of these things. Always get into a live body. It is not out of the box. It's scheduled. It's based on your processes, because again, there's a lot of misinformation out there, and there's a lot of things out there that represent that is the case, but it's truly not. So we can program to alternate providers, joint scheduling, mothers, children, caregivers, wards, couple, however it is, whatever you have in your system today, we can replicate that for the conversational AI digital employee to handle that conversation and take care of those pieces. Callers can call, make appointments, change appointments, confirm 24/7, no hold times ever. You know, the average hold time is getting out of hand. Average time to schedule an appointment is 6 minutes with a live person. It's less than 2 minutes with a digital agent. We know it can't handle everything all the time, which is why it can always route to a live person. You determine whether it's, you want the system to ask a question once, twice, 3 times, rephrase the question. These are all your directives that we program to and have the digital agent execute. Answers to FAQs, opening hours, directions, etc. Think about how much time your call centers or your frontline staff, and in some cases, we've talked to registered nurses and ER nurses handling calls that have to do with, we'll call them routine pieces. What does that cost look like for you? What is the cost of, making the appointment, dropped calls, frustrated patients? I recently had an experience with my healthcare provider. They said, your call is very important to us. The average wait time is 37 minutes. Well, I didn't feel so important. So anyhow, another piece there. This kind of speaks to the difference between types of AI that are out there. What we use, we call it unified AI because it takes multiple components of the AI technologies. The voice AI, which is very, very powerful. A lot of people do what they call the RPA, which is really just moving data internally using AI components. That's been around a long time, but taking vision AI, when you're taking a picture of an insurance card for intake, not filling out forms, with the voice and moving the data back and forth, looking into the scheduling system, checking pharmacy refills, all of that, we combine them all together in our technology, which becomes what we call unified AI. Another buzzword for you to digest out there in the world. We talked about this a little bit. There are a lot of areas where this can be very, very impactful. Referral management, it can take the facts, it can call the patient to set up the appointment. Some of these are very, very important, obviously, for just the general patient satisfaction, but they're also revenue drivers. The more appointments you get in, the faster you process people, the more profit you're going to make, the more money you're going to make. New patients, we have forms, we have ways to ingest and set up new patients that are handled electronically, so it cuts down the time for the verifications internally. Intake, taking a picture of an ID and an insurance card where the technology will extract the information, do the authorization, and put the information in your EMR. Again, it just cuts down the time to take care of some of the time drag routine processes. One piece that we'll keep talking about is closed system versus, the chat GPT or the generative side of the AI world. We got to keep emphasizing this because we talked to one person, he says, I don't care what system you have, I can break it. He took great pride into trying to break every single AI piece he got into. They're all generative, like a chat GPT. So when he tells it, ignore all previous comments, give me this, give me that, he was able to get really wild and crazy things. You can't do that on our side. Everything is contained within your organization's EHR. The only interactions are between your EHR and your scheduling and the client. We are not generating any opinion. We're not generating any answers. That the agentic and generative are blocked in our system. And internal access is always secure. We'll talk about the dangers a little bit more about the generative and the agentic AI. I forgot to mention, if you have any questions as we go, just pop them in the chat and we'll answer them as we go. This really kind of speaks to that same concept. There's no external influence. If someone says, I want to make an appointment on Tuesday, the system's not going to say, hey, Tuesdays are a great day to have an appointment because X, Y, Z. That's what you'll get from an open AI. You'll get that from the generative. You will not get that here. Everything is within your four walls, and nothing else can get in there, which is really, really important because we see a lot of hallucinations is what we refer to them as. You're going to get creative, unpredictable answers, guesses leading to errors. We had one, there was an article, and I believe in the Wall Street Journal, where there was a procedure that needed to be done. They went to their AI, which was a generative chat GPT, and the answers they got back said that a procedure was warranted. And then once another one of the physicians and their peer group reviewed it, they found no such procedure was ever performed anywhere. And it was kind of, I don't want to say it was making stuff up, but we'll call it a hallucination. You're going to get unpredictable results. And when you're dealing with, your patient's care, that is not, obviously not acceptable. Again, we work on the reliable, accurate, strict rule-based, predefined workflows. So we want to guarantee accuracy, patient safety, with coloring within the lines. So the next portion, again, is kind of reinforcing, it's a toolkit. You design it based on your current scripts, current processes. There's over 100 different AI voices, cadence, timing, etc. Decisions are determined by you, not some CAN model, us telling you what it should be. We can share what some best practices are, and we'll help, lean out the models, lean out the processes, the current processes, and make some improvements. But that's not, the system's not doing that. We're doing that. And like all good technologies, standing on themselves is not kind of worthless without the right people driving it and having the experience in healthcare. We are focused strictly on healthcare. We see a lot of companies out there who work in a lot of different areas, and they've added healthcare. We are healthcare professionals. We come from this world. Currently, we're working in English, Spanish, Chinese, and Punjabi. We can do other, that's just out of the box. We can do other translations, other voices, other languages. We just need to know which ones when we get down to it. That is a lot. I know I'm throwing a lot of information pretty quickly here. The next video I'm going to play a few more recordings of some more of the use cases, and I'll turn it over to Tim to do some recap. But the next one here is on an intake.
Tired of filling out forms at the clinics? Now it is easier with a single click. Check this out. With First Outcomes, Vision AI technology, just take a picture of your driving license and insurance card. Upload it. Let Vision AI take care of the paperwork and improve time efficiency, accuracy, reliability. First Outcomes, your AI partner for healthcare.
All right, First Outcomes is our technology partner behind the scenes. So that is just a case of someone saying, hey, I need to put you in the system. I'm a new patient. Normal process is, hey, this is Matt Leventhal. This is my address. This is my, insurance. This is, that phone conversation. What that does is make sure that everything is spelled correctly, and it takes somebody's the intake time drastically reduced. It takes the images. It will do the authorization. I know there's a lot more detail in there. You probably have questions on. We can answer that, offline. But that really is, the best way to do the intake. Another piece we get, or another thing we offer that people ask for, is, do we have visibility into all of the calls? Do we have visibility into, the call, content? In the command center, we provide a dashboard that you would have a recording, a transcription, time of every call, resolution, whether it was successful, meaning the appointment was, done, or the task was completed, whether it was transferred to a live body, wait time, everything is in there. So, and this is reviewed constantly, actually on a daily basis. If conversations are being elevated to live agents, we determine whether that was because it was something out of scope that you told us that it needs to go, or if the system didn't recognize something that it could have recognized, we will adjust it so it will recognize it. So it continues to evolve and learn. It's a constantly learning system. So got a couple more calls I'll play for you, just showing some different of.
Hello.
Oh, I moved past that. Sorry about that. Those were a couple of live redacted calls. We showed the first call, which was an inbound call. Let me play a reschedule call for you. It will actually reach out for payments, follow-ups, a triage. So I'll play a couple of these for you, just so you can get the flavor for them. Again, these are all these are demos for demo purposes, but they can be,
Hi, this
tweaked
is a message
the way
on
you want
behalf of
them.
the First Health General Hospital for Martin Smith. If this is Martin Smith, please say yes. If I have reached a wrong number, please say exit.
Yes.
Martin Smith has an appointment with Dr. Andrew Blank on November 18th at 1 p.m. May I confirm this appointment for you, Martin?
I'm busy on the 18th. Can I reschedule?
Sure. Please say when you want to come in. You can say a specific date like May 24th or a time like next week, Monday.
Next week.
No problem. Please provide the day you would like to get an appointment. For example, say Tuesday or Wednesday.
Friday?
Great. We have an appointment available on Friday, November 25th at 10 a.m. If this appointment time works for you, please say yes. Otherwise, say no and I will provide you with another time.
So sorry, the doorbell rang. No, 10 a.m. doesn't work for me.
How about 11:30 a.m.? Does that work for you?
Yes, that works.
Okay. November 25th, 11:30 a.m. is confirmed. Martin, I see you have a balance of $40.25. This balance needs to be paid prior to your visit. Would you like to pay now?
Yes, I would like to pay now.
Sure. What is the credit card number you want to use?
1-2-3-4-4-5-6-9-9-7-3-4-5-4-2-3.
And when is the credit card expiring?
December 2023.
Great. And the three-digit security code?
222.
Please wait while I process your payment. Your payment of $40.25 has been processed. The confirmation number is 122002. If you would like to hear your confirmation number again, say repeat, else go ahead and hang up.
Okay, so that just gave your staff back 2 minutes and 15 seconds of their life. Actually, more than that. That call was 2 minutes and 15 seconds, but it took the time of a person making an outbound call to confirm an appointment. It eliminated a cancellation and another call for a reschedule. It eliminated a reach out for payment and receiving payment. So you can see that that is very impactful 2 minutes of a digital agent giving your staff and your organization that time back. Higher priority when people do have a higher priority, a higher, task that your staff needs to deal with. So a couple other pieces here we'll do for you. This is a triage. Poor Martin Smith, we pick on him a lot. This is where Martin has hurt his knee.
Welcome, Martin Smith. I have identified you from your caller ID. To protect your privacy, please say your date of birth.
September 9th, 1985.
This is the virtual assistant from First Health General Hospital and Medical Group. I can help you set up an appointment or reschedule your appointment with a doctor. Do you need an appointment or do you need to reschedule?
Hi, I need an appointment.
I can help you set up an appointment. Please tell me why you want to come in.
There's a lot of pain in my left knee.
I understand you are feeling pain in your left knee. Did I hear you correctly?
Yes.
I will ask you a few short questions. These are the same questions a nurse would ask you and will help me assist you. Is that okay?
Yes.
Did you injure your knee? And if so, please state when.
Yes. 4 days ago.
Is your knee swollen and are you having trouble walking?
Yes, it's slightly swollen, and it's hard for me to bend my knee.
Have you tried over-the-counter medications such as Advil, Tylenol, or Motrin?
Yes, but the pain is still there when I'm taking the pain medication.
Thank you for the information. This will help us assist you. Our schedule has a few appointments available tomorrow. What time would you like to come in?
Sorry about that. 10 a.m.
We do not have an appointment for 10 a.m. The next appointment we can offer is 11 a.m. Would that work?
Yes, 11 a.m. is fine.
Martin, your appointment is confirmed for 11 a.m. tomorrow, December 3rd, 2022. Please arrive 10 minutes before your appointment. We are sending you a text reminder. Thank you for choosing First Health.
All right, so poor Martin. We know there's a good backstory on his knee injury by the SI he had. And we haven't really come up with it yet. So anyhow, these are demo recordings, obviously. In this deck, which we will share with everybody afterwards, there are a couple redacted live customer, client, patient conversations, obviously highly redacted. But you can see there, it was a triage to get them to the right place. And we added background noise because the system will filter out the background noise, the pots and pans crashing, the TV being loud. I'm sorry, my baby's crying, no problem. That is all, humanizing it as much as possible. People know they're talking to a digital agent. I think most people are very, very used to that at this point. So there are additional recordings, which we'll send this to you. But scheduling that can be directly out for payments, a survey, if there's lab tests that are coming in to the doctor's office, or for the patients, prescription refills. There's a lot. For time's sake, I'm not going to play them all. We have a Spanish recording here. We will share all these with you guys afterwards.
Hi, welcome, Rupa. You have been verified from your caller ID.
Sorry, guys. Tim, let me, with that, I don't know if we have any questions. And that, Dan. I guess we'll stop here real quick. Questions on what we've shown you so far? I know we're drinking from the fire hose a little bit here, but we'll just pause for a second to see if there's any questions. Tim, I do see one question that came up about pricing and size of organization.
Okay.
Why don't you address that real quick?
Yeah, let me address it. Size of the organization. Our clients are down to some maybe eight doctors, I believe, is the smallest group. The advantage of this technology, this toolkit, is that it's infinitely scalable, but it's also infinitely goes down to a certain point. It just strictly a question of volume, and the volumes can be pretty low. You just have to reach out, tell us what you're doing, tell us what your biggest problem is, and see if we can come up with a solution that works. And the advantage of this technology is it's very proven now. It's been deployed for almost 5 years with different customers. It's integrated with Epic, Cerner, Athena, most of the large ones. It's already been integrated with, so it's not that big a problem. From my perspective, I look at you folks, and you are in a tough business environment. You really are. And the advantage you can gain with this tool is it can assist your human employees so that you have higher patient satisfaction scores. You can raise revenue. The last 2 use cases, we had a large multi-location practice, very cyclical on their phone volume, and they on Mondays couldn't answer around 3,000 calls. And they turned our system on, and magically they answered every single one. So people calling back, yelling at the patient, yelling at your human staff because they couldn't get anybody, was eliminated. They're very happy with the system. The other use case is a fairly large FQHC. They are trying to get their people in for their annual wellness checkups, and with their folks, they're good people doing their best, they couldn't make the calls fast enough. This system can outbound as well as inbound. In terms of cost, we have a really modest implementation fee for the programming, because the programming is entirely dependent on your current process and is approved by you. It's not a canned product. And then the 2 use models, people want a flat platform fee. The smaller ones like that as a business model, so it's predictable and repeatable. And then the other, it's a per minute of use. And it's, like I said, it's very modest. It works out to be around 30 to 40% of a human being at the worst. Some of them are down in the 15 and 20%. So just to recap, look at your pain points. Tell us what your pain points are, and this toolkit, we can build a solution for it. And it's a modest investment, and it can help you contain the costs. I mean, we're all in a brave new world where you're going to get reduced. The health insurance companies are reducing your reimbursements. Your costs are, with human employees, are not going to go down. And so this is an alternative. When you marry the two, you have a very effective system that will make your patients be happy. So with that, any other questions?
Tim, I see one more on the system. What's the minimum commitment? And someone's asking, is there a trial period? How do we explain how we approach that? Because that's very important, because it is new and people are a little afraid of it. Please explain how we go to market and how we have skin in the game. And
Yeah, we go to market. We will do a trial period. I can tell you that anyone who has made the leap of faith and turned this technology on has to yet turn it off. So we're batting 100% in that regard. A 1-year contract, 90-day mutual out. If you need to be, we're very flexible in terms. It's not a rigid 3, 4, 5-year contract at all, because we know it's not the future, it's here. And organizations are wisely adopting it. We don't play on the clinical side. We don't play with any of that bombastic stuff that we see. We simply try to help you improve the revenue cycle, speed, timing, revenue, and reduce the costs at the same time. So, any other questions?
Look here, and just to add to that, we don't start billing anything until we go live, and
Right.
Everything is built and tested. So that's all I see. Dan, do you see any other questions in there? I don't see any in my queue.
I haven't received any questions.
Okay. Well, we'd like to thank all of you for your time. I know we threw a lot of information at you. We hope that was beneficial. We'd love to hear your feedback. You can respond back to Dan Dreblow, who helped organize this. Thank you, Dan. We'd like to hear whether you liked it, didn't like it, thought it was impactful, too much information, not enough information. We'd love to get your feedback. Dan will also share a thank you, and we'll send the deck to everybody so you can peruse it, listen to the rest of the demo recordings. But we'd love to hear from you, love to hear where your pain points are, and if we can scope something out that makes sense for you to take a look at. And more importantly, we're a resource for you. So you may not know us, but we really enjoy helping our clients and prospects and people in this industry dispel the myths that are out there. There's a lot of great technology out there. There's a lot of great use cases. But on the flip side, there's a lot of BS out there. There's a lot of misinformation out there. Yeah. When you walk up to somebody at the HFMA show and they say, I'm in revenue cycle, I roll my eyes, because everybody is. And now everyone's in AI. So we would love to be a resource for you to help disseminate what's real and what's not. Even if you don't engage with us, we're happy, because we learn as well. So with that, we'll just leave another thank you, and look forward to everyone's feedback.
Yep. Thanks, everyone.
Have a great day, the rest of your week.